सभी दर्शकों को एक बार फिर मेरा नमस्कार। आप लोगों ने अक्सर सुना होगा कि वेट गेन करना बहुत आसान है, पर वेट लॉस के लिए बहुत अधिक पेन्स लेने होते हैं। पर अगर आप इसके टेक्निकल एस्पेक्ट्स को समझ लें, तो ये आपके लिए कुछ आसान हो सकता है। एकदम आसान हो जाएगा, ये कह कर के मैं आज शीनू जी के जो इतने एफर्ट्स रहे हैं पिछले 6 महीने के, उनको डाइल्यूट नहीं करना चाहता। नमस्कार शीनू जी।
नमस्कार।
आज
नमस्कार
हमारे
डॉक्टर।
साथ में जुड़ रही हैं मिसेस शीनू गोरम। 46 ईयर्स इनकी एज है। कनाडा से हमारे साथ जुड़ रहे हैं। इनका वजन पिछले करीब 10 से 12 साल के अंदर बढ़ा हुआ था। बीच में एक बार इन्होंने कम भी किया 2009 में, पर फिर वेट गेन हो गया। या तो उन्हें वो टेक्निक्स का आइडिया नहीं था, उसका अंदाजा नहीं था, दोबारा से पुट ऑन किया। और जब इनका पीक था वेट का, दैट टाइम इट वाज 163 पाउंड्स, मीन समवेयर 73 केजीज। जनवरी के अंदर 2024 में उन्होंने अपना वेट लॉस जर्नी की शुरुआत किया। एलडीसीएफ डाइट फॉलो किया, और जैसा अक्सर मैं लोगों को गाइड करता हूं कि वेट लॉस किस प्रकार करना है, उसको काफी सीरियसली करते हुए उन्होंने रिकॉर्ड 6 से 7 महीने के अंदर 117 पाउंड इस समय उनका वजन है। और लगभग 53 kgs is her current weight. So she lost almost 20 kgs. So we will understand from her how was her journey, what pains she took, and how she did it. Namaskar.
Thank you, Dr. Agarwal. First
Yes.
of all, I'm so grateful for the whole journey and your guidance. Under your guidance, I achieved
My
my
pleasure.
goal. Yes, and I would start saying my gratitude to your team also,
Yes.
starting from Lakshmi ji, who conducted all the meetings and everything, and
Right.
my dietitian Priyanka ji.
Right.
So good, and I never felt
Thank
that
you.
I'm only one in this journey. And I
Mhm.
achieved my goal earlier also, as you mentioned, in 2009.
Yeah.
But right away, it picked up so quickly, and I moved on to same weight gain.
Right.
And now, when I heard about you from my mom, who's already on her journey for
Right.
diabetes reversal, she's very close to achieve her goal.
Right.
And she used to, tell me that you should contact Dr. Agarwal, and he's so good, and he's doing such a great
Thank
effort
you.
for my journey.
Really
And
wonderful couple they are. Yeah.
somehow I was, reluctant, or you can say, getting really lacking in this motivation also,
Mhm.
because I had bad experiences about weight loss in the past.
Mhm. Okay.
And for my mentality was just like, it can come back again, because
Ah.
nobody made me understand that there is a technique, there is some, formula to apply it on
Yeah,
your
we can
own.
see
Yes.
in layman language, we can say formula. Otherwise, it is game of hormones.
Right.
If you will not activate your insulin,
Yeah,
you will keep your weight under control. If you will stimulate it again and again, that will force to gain weight. So
exactly.
mostly people used to do that. And nowadays, dietitians used to guide 6 meals in a day.
Right.
And if you are increasing the quantity a little bit more carbs, then if
Mhm.
you are stimulating 6 times insulin in your body, very fast you will put on weight. So there
Right.
are techniques which guided you also to other patients also. So
Yes.
if you understand that, for lifetime you will not gain weight. So how you started, and what diet you followed, what pains you took to achieve
I,
this?
yes. Thank you for asking. I started in 2024 January, after I think 15th of January.
Yeah.
And at that time, my weight was 163 pounds, which was 73.9 kg. And I started getting diets offered by you, and
Right.
your timely meetings, and
Right.
I discussed my health issues with you, that
Right.
I'm
Right.
facing these physical problems or something, and you heard me properly, and you guided me that if you do this way, and if you follow the diet and time frame, everything combined,
Right.
and your weight will reduce. And
Right.
at that time, in the beginning of the consultation, I was not sure, because I didn't have, that belief system in me that maybe it
Right.
won't work when I
Mhm.
started.
Mhm.
But then step by step, I followed everything.
Yeah. No, but you truly followed, huh? Seriously, you
Yes.
followed.
And I
Protocol also,
bothered
dietary
Priyanka.
protocol as well as exercises also. Yeah.
Right. You showed me some
I will
exercise
appreciate that.
also.
Yeah. Yeah. Yeah.
Yes.
Please carry
And
on.
then Priyanka ji was my partner in crime, you can say. Whenever I felt like I'm going to a party tomorrow, and then how will I survive? Because people will be forcing me, like, you should eat, you're not eating, this is why you're like that. And then she used to encourage me, don't worry, Sinuji, you eat whatever you want to, and then we will detox next day.
Right.
And this was such a beautiful thing. Like, you go and you're eating, also people who know that you're eating or not. But I experienced, I was thinking that I have to stop eating certain foods, but everything was in my kitchen.
True.
Now with this diet, I don't have to go buy anything. It's at home and I'm feeling full every time.
Very
And
true.
I have my energy level like 100%. I'm very spiritual person from heart. And then, my spirituality is also growing with this
I
side.
saw that
And
message and all. Yeah. Right.
yes, and it's beautiful.
Yeah. So
I,
it's
I, I
very
will
true.
recommend this diet to everyone. And you don't have to go and buy any chemicals to
Right.
harm bodies that you will be, facing results in later in your life. But this is everything, like flax seeds or other seeds, and
Yeah.
you're
Yeah.
giving your own um, flour making
Otherwise,
techniques.
as well as those chemicals are concerned in Canada, UK, US,
Right.
all those injectables are also available. Few
Yes.
patients used to take support of that, but if you are able to do without that, that is really achievement. And by this technique for lifetime, you can maintain yourself.
Right. And
Otherwise,
if
if
I
you are doing with that help of those injectables, then again you will put on
True.
after withdrawal.
I really understand the technique you showed,
Hmm.
like eating in that window frame, that is the time, 2 meals a day. And then I like nuts a lot. And then that is also, I reduce my diet proportion to have nuts
Hmm.
in different timing, which is also, I consulted with you and my dietitian, and she kept on offering me like this way you should eat, and then you won't be getting your weight back on your
Yeah.
body.
I will
Yeah.
appreciate you. You took as a challenge, you did it because see, you was not having as such obvious health issue
Yes.
like diabetes or neuropathy or any blood pressure, heart problem. Those nothing was there.
No.
So sometime for patients, those illnesses are motivation. But for you must be having few things like fatty liver, which is silent,
Yes.
triglyceride cholesterol levels, which is silent. In few females, not for you, few females, some PCOD or thyroid problems. So, but people are not so keen that they are ready to reduce weight. They easily don't give up their meal plan or their food, their eating habits. Because see, once if somebody is obese, means somewhere she is foodie or he is foodie.
Right.
And without such type of illnesses, if somebody is taking as a challenge, that is really appreciable. And you did it. So
Thank you. I
your
couldn't do it
your
alone.
family also must have supported you in this.
Yes, yes. Everybody at home, my relatives, everyone. Plus, I see the glow on my face. It's not seen by me, but it's obvious by other people
True,
also.
true, true.
What are you doing? Like, it's a total transformation. This is a new person. So
Acha,
I'm getting.
somebody is not asking that why you are getting so skinny and all.
Yes, they're asking. And then I recommended my family members also who are living all over in the world. And I'm telling them that they should contact you. And I'm guessing that they're already in touch with
Nah,
you.
but you can share your diet with them. We don't mind. We don't.
Okay,
If
sounds good. Thank you.
somebody is
Thank you.
getting benefited in the family or in friends, so
Yes.
many
With
many
friends, I
congratulations.
had
Yeah,
one commitment that I first reduce my weight and then I'm going to tell them.
right.
But indirectly, I recommended them that there was one of my friend who is already visiting Bombay, and I said, you have those many health issues, you should see Dr. Agarwal.
Sure,
And
sure. We'll take
he
care.
will be coming. And
So many congratulations to you and your family for
thank you.
achieving the goal. And if you want, you can reduce further 3 kgs because the ideal is 50. But if you want to continue with 53 because you was not having any obvious health issue, so you
Yeah.
can keep on with 53 kgs, no problem. So congratulations to you, your family once again. Thank you very much for sparing time
To
for
you and
people.
your team.
Any message you want to give people?
My main message is, follow the guidelines given by you. And this is very important. You take the diet and you do your own formulas or own recipes in there, it won't work. And then you blame Dr. Agarwal's diet. And this is,
Yeah, but I
this
would
is
like
not,
to ask one thing. Is it very tough?
no,
Okay.
it's not. Everything is in your kitchen. You just have to put your time and effort.
Right.
That's a
Right.
different thing. Everything is in there. You just buy once, a big packaging of flex seeds or other seeds, whatever you say, and you use all those things.
Right.
It's in our pantry. Everything is there.
So,
Nothing hard.
right. Thank you very much.
Thank you, Dr. Agarwal.
Thank you very much.
Gratitude.
Take care.
Thanks.